Hello everyone, I'm Anas Al-Ubaidi, and the title or the topic for this lecture is Adapting to Evolving Healthcare Models within the chapter that covers the foundations of excellence in healthcare administration within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. Healthcare is undergoing rapid transformation, driven by advancements in technology, policy reforms, and shifting patient expectations. These changes have given rise to innovative healthcare delivery models such as integrated care networks, ICNS, and value-based care systems. For administrative professionals, staying ahead of these changes is not just beneficial, it's essential. Key points. Understanding integrated care networks, ICNS. ICNS, integrated care networks, unit healthcare providers or clinicians, including hospitals, clinics, specialists, and community organizations, into one cohesive system of care. The primary goal is to provide seamless and continuous treatment for patients, especially those with chronic conditions. Features of ICNS integrated care networks. Collaborative approach provides providers or clinicians work collectively under shared goals. Continuity of care. Patients experience smoother transitions between care settings, i.e., in other words, from hospital to home care. Data sharing, shared electronic health records, EHRS, ensure every provider has up-to-date patient information, i.e., a patient with diabetes sees a primary care physician, dietitian, cardiologist, and physical therapist through an ICN, integrated care network. These providers or clinicians communicate frequently, share updates via common EHR, and collectively create a care plan tailored to the patient's well-being. Challenges for CMAAs, Certified Medical Administrative Assistants, managing increased inter-provider communication, training staff to use shared EHR systems effectively, ensuring HIPAA compliance across multiple care settings. And here is a diagram on Integrated Care Networks ICNS. Value-based care (VBC), a paradigm shift. Traditional fee-for-service care rewards providers for the quantity of services delivered. VBC, which is value-based care, on the other hand, rewards healthcare organizations for improving patient health outcomes and reducing costs. Key components: outcome metrics, preventative care focus, and patient-centered, i.e., under a VBC, a value-based care model, instead of being reimbursed for every test or procedure performed, a clinic receives bundled payments for achieving key benchmarks, such as reducing readmission rates for heart disease patients. Benefits for CMAAs, Certified Medical Administrative Assistants, developing reports that track metrics and measure performance, enhancing patient education efforts to promote preventive care practices, coordinating access to diverse healthcare services, improving patient satisfaction. And here is a diagram comparing healthcare payment models between the traditional fee-for-service and value-based care. The role of CMAAs, Certified Medical Administrative Assistants, in these models. CMAAs serve as the backbone of healthcare administration in both ICNS and integrated care networks and value-based care. Their evolving responsibilities encompass facilitating collaboration, optimizing technology, and ensuring processes align with the new goals. New responsibilities: data coordination, patient communication, scheduling, and resource optimization, i.e., a CMAA working in a value-based hospital creates VBC, value-based care model, creates patient follow-up schedules focused on Post-operative recovery rates monitoring outcomes at crucial intervals to reduce complications. Challenges ahead: navigating rising complexity and compliance standards, continuous professional growth to stay ahead in these innovative models. And here is a diagram showing the CMAA responsibilities in healthcare models. Application examples: we have coordinating team-based care in ICNS integrated care network scenario. You're asked to schedule collaborative team consultations for a patient with cancer involving their oncologist, nutritionist, physical therapist, and surgeon. Steps here: review the patient's EHR to identify all involved care providers. Use scheduling software tailored to support multi-provider appointments and send a clear communication about the patient's care plan to each provider. Resources here: advanced EHR systems for real-time provider updates, multimodal patient communication tools. Results: streamlined care delivery reduces patient stress and enhances team-based decision making. Managing quality metrics for value-based initiatives. Scenario here: your clinic is transitioning to a value-based arrangement and must reduce unnecessary emergency room visits. Steps here: analyze data from EHRs, electronic health records to identify trends and frequent ER patients. Schedule follow-ups and preventative care sessions for at-risk patients. Work with healthcare providers to develop patient education materials. Resources here: data analytics tools for identifying frequent ER utilizers, materials for educating patients on at-home health maintenance. Result: reduced ER visits and improved population health outcomes. Ensuring seamless data sharing across ICNS integrated care network. Scenario: a physician requests updated patient imaging results from a remote radiology center. Steps: retrieve the patient's imaging data using secure portals, cross-check their information for accuracy before transmitting it, confirm receipt and notify all relevant staff. Resources: secure file sharing platforms for healthcare, training for staff on cloud-based data solutions. Result: faster data sharing enhances ICN efficiency. Patient education about preventative care. Scenario: your clinic wants to educate high-risk elderly patients about managing blood pressure. Steps: organize educational workshops and distribute visual aids. Schedule follow-ups to discuss progress and incorporate remote monitoring, i.e., wearable devices to track patient blood pressure at home. Resources: telehealth platforms and wearables, educational tools tailored to elderly patients. Result: increased patient awareness, prevents chronic disease escalation. Addressing social determinants in value-based systems. Scenario: a value-based initiative requires addressing transportation barriers to care. Steps: partner with local transportation services, embed scheduling for rides directly into patient appointment plans, notify patients of the availability of a free or affordable transportation. Resources: partnerships with community organizations, patient transportation management software. Result: improved adherence to care plans due to reliable transportation. Reducing readmissions through follow-up coordination. Scenario: monitor post-surgery patients more effectively to reduce complications. Steps: schedule follow-up calls within 48 hours, track wound healing progress and medication adherence, notify the care team of any red flags. Resources: follow-up tracking systems, patient-centered risk assessment tools. Result: fewer hospital readmissions and better post-operative outcomes. Automating quality reporting for reimbursement. Scenario: you must report medical quality metrics to meet value-based reimbursement requirements. Steps: use reporting dashboards to simplify submission to payers, track ongoing progress toward annual targets, and then flag areas requiring immediate improvement. Resources: Medicare specific reporting tools, quality reporting templates provided by stakeholders. Result: accurate submissions, improve compliance and financial performance. Implementing telehealth services in ICNS, integrated care network. Scenario: expand telehealth to connect rural patients with specialists in ICNS. Steps: identify patients who qualify for remote consultations, set up and test telehealth software with their devices, coordinate documentation requirements to facilitate these visits. Resources: telehealth hardware/software, dedicated IT support for seamless setup. Result: care becomes more accessible to underserved populations. Educating staff on value based evaluation. Scenario: new staff are unsure about VBC, value based care, expectations, particularly related to chronic care management. Steps: organize regular education sessions with detailed case studies, create cheat sheets and reminders for workflows, monitor staff performance post training for improvements. Resources: online learning platforms for remote staff education, onboarding tools tailored for value based models. Result: builds institutional knowledge and confidence in navigating this transition. Facilitating behavioral health integration. Scenario: integrate behavioral health professionals into primary care appointments to boost patient outcomes. Steps: identify patients requiring integrated behavioral health consultations, plan appointment blocks for multidisciplinary visits, train front office staff to communicate the importance of holistic care plans to patients. Resources: behavioral health databases integrated with EHRs, patient outreach, material for mental health services. The result: improves patient outcomes by addressing mental and physical health collaboratively. Next, we have summary tables. Here we have table on differences between traditional care and evolving healthcare models. Table on key features of integrated care networks, ICNS. Table on key metrics tracked in value-based care, VBC. Table on administrative tools for evolving healthcare models. Table on benefits and challenges of evolving healthcare models. Next, we will revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. What is the main goal of integrated care networks, ICNS? A. Streamline billing processes between care providers. B. Promote seamless communication and collaboration among healthcare professionals. C. Increase the number of diagnostic tests ordered for patients. Or D. Prioritize fee-for-service over outcome-based approaches. The answer is B. As ICNS focus on enhancing care coordination and fostering communication between providers or clinicians to deliver holistic patient care. Question 2. Which metric is most commonly tracked in value-based care VBC models to prevent unnecessary readmissions? A. Emergency room visits. B. Care plan complexity. C. Readmission rates. Or D. Staff-to-patient ratios. The answer is C. Readmission rates, as tracking readmission rates helps VBC, value-based care models, identify gaps in follow-ups and improve long-term patient outcomes. Question 3. What should the CMAA prioritize when managing patient follow-ups in a value-based care models? Or model A. Scheduling appointments based on staff convenience. B. Identify and prioritizing high-risk patients for follow-ups. C. Collecting patient satisfaction surveys without addressing care gaps. Or D. Assigning follow-up visits only to patients who request them. The answer is B, as VBC emphasizes on preventative action and prioritizing high-risk patients improves outcomes. Question 4. Which of the following best reflects a responsibility for CMAA or CMAAs in integrated care networks, ICNS? A. Ensuring that providers comply with fee-for-service billing standards. B. Managing continuity of care by scheduling seamless transitions between providers. C. Promoting individual provider branding within the network. Or D. Assigning patients randomly to providers without assessing their specific needs. And the answer here would be without assessing their specific needs, assignment ignores. Um, the answer here, the most appropriate proper answer would be B, as ICNS focus on providing continuity of treatment and CMAAs play a crucial role, essential role in coordinating transitions. Question 5. When implementing telehealth systems within a value-based care model, VBC model, what should be a CMAA's first priority? A. Ensuring that all patients have high-speed internet at home. B. Training providers in troubleshooting technology issues during consultations. C. Identifying and scheduling patients who benefit the most from telehealth services. Or D. Replacing in-person consultations with telehealth for all patients. The answer, mostly, and the most proper and appropriate answer would be C, as telehealth solutions are especially valuable for rural or high-risk patients who face barriers to in-person visits. And here we come to end of this lecture. Thank you very much and goodbye.